Alright, just following up on a comment somebody had on one of my videos. It says, please make a video on diarrhea, chronic diarrhea. Bro, I don't have constipation, but chronic diarrhea. I've lost 7 kg. Went to many gastro. My diarrhea is under control. With 1 Imodium and 2 Librex and 1 probiotic a day. Not only have loose stools, and sometimes even firm normal stools, and sometimes loose and watery stool. I got a lot of tests done, even ultrasound and all this stuff. What do you think I should do next? Doctor think is IBS. It's been almost 10 months. First of all, none of this professional medical advice, diagnosis, or treatment. You gotta continue to work with your doctors to find the right solution for you. I'm just giving you some ideas along the way that could be helpful on your journey. When you're dealing with chronic diarrhea, there are so many different causes that are out there. It's absolutely crazy. Now, over here, they have all these different things. It might be different medications you're currently eating. It could be different foods that you're eating right now. What you can do, you can look at what you're eating now and start to eliminate certain foods. Just think about, all right, this may be giving you some type of allergies. I don't know what that's going to be for you. I'm just saying when it comes to food, everyone's a little bit different. Just because your family members are eating the same thing doesn't mean that you can either. Now today I'm going to give you some ideas. First of all, you're having all these watery stools. You got to find a way to replenish your electrolytes. So you guys can screenshot this particular recipe. It's from Barbara O'Neill. So they're using ginger, water, maple syrup, apple cider vinegar, 3 lemons juiced. Okay, something like that. And you can also look into coconut water, getting some watermelon. Your electrolytes, you got the sodium chloride, potassium, calcium, magnesium. You have to replenish these because right now your body's very, very weak. It's losing electrolytes as you are having these constant diarrhea battles. And for the manganese, you can look into raspberries, blackberries, and you don't want to overdo on these because you may experience more chronic diarrhea. Now, your situation is definitely not uncommon. It's very, very common all over the world. I did a quick research on this. The volume of people that are searching for diarrhea relief or looking for some type of solution, very, very high. Millions and millions of search volume. This is another recession-proof keyword. Nobody, just because the stock market crashes, the economy crashes, people will continue to search for diarrhea relief or how to fix diarrhea. Now I'm going to throw something on the radar screen you probably haven't really looked into before. Okay, so these are parasites, but these are much, much smaller parasites. They're single cell protozoans, and you need to study these guys one by one. I don't know where you live. It seems like you may be living in the UK or in Australia, and these things are also very, very common. When we're dealing with something like malaria, malaria is a form of parasite, and they're very, very small. They start to attack your red blood cells and other cells in your body, causing a lot of inflammation. Now, in my last video, if you watch the whole thing, I went through many, many other parasites that could be in your body right now, and that could be causing a lot of the chronic diarrhea. I just want to go through these real quick. For example, you have liver flukes, pinworms, tapeworms, and roundworms. When you have a multitude of different parasites, these are full-blown organisms. These are not microscopic things. They're going to cause so much disruption in your system, and chronic diarrhea could be one of them. The liver fluke, you're going to go online later on. You can watch this video for yourself. Just type in Animal Planet liver fluke. Animal Planet, parasites eat at a woman's liver, causing agonizing pain. Monsters inside me. When we don't get rid of our internal parasites comprehensively, you're going to have problems because parasites are so powerful. They know how to survive and replicate inside of you. And there are different parasites that are causing disruption, not to your liver, but also not just in the liver, but also in your kidneys. Okay. Now tapeworms are also very common. If you're eating undercooked meats in beef, pork, or even fish, people are eating a lot of sashimi these days. And it's going to cause so many problems because they reproduce so quickly inside of you. So looking at their anatomy, they're going to lay so many different eggs. So even if you are having diarrhea, you're not going to be able to flush them out because they're hooked onto your body, right? And they have these different suckers that will give them a very strong foothold in your digestive tract. Over here, somebody pulled out a tapeworm 59 feet, roughly 18 meters. Parasites are also very common in your pets, in your cats and dogs. I don't know if you have animals around you. Maybe you don't have them now, but you may be hanging out with a neighbor's pet, and that can get into your system. The risk factors are for many. If you've been traveling different places, even local water, you have to be very careful. Some of them could be contaminated. If you're dealing with pets, you're eating a lot of raw foods. These things could cause chronic diarrhea. Roundworms, according to PubMed, you got 800 million to 1.2 billion people worldwide that got this parasite. And over here you have the pinworm. According to PubMed, it's affecting close to 1 billion people worldwide. Okay, so this is somebody with so many roundworms sitting in their digestive tract, and they have a lot of problem even just going to the bathroom. Now you may not have this many. I'm just saying that they do survive and replicate. Now you told me that you've been going to the GI and then they've been running different tests on you. Well, let me tell you what. False negative malaria rapid diagnostic test results and their impact on community-based malaria survey in sub-Saharan Africa. When these doctors are running these different tests for parasites, it is my personal opinion they're coming back a lot of false negative. They want them to be false negative so you can continue to go see them time and time again because your problem is not resolved. So what we're going to do, you're going to go and look for some anti-parasite medications. Okay? Work with your doctor, work with your naturopathic doctors, work with your integrative medicine. Find people that actually know how to get rid of internal parasites using herbs. Okay, not just with OTC medication or prescription strength. Now, so some of this wormwood, black walnut. Okay, this is Intestine Pro. This product, I think, is only using all herbal products. Over here, this product, Intestinal Edge, also very similar to this one. There are many different products on the market, and you should actually be a little bit thankful for your chronic diarrhea because you can actually jump into this right away because now you're getting the waste material out of the body. This is not very safe for people that are chronically constipated. I want them to have a clean small and large intestines before they even venture down this path. But for you, you can actually take something like this. Of course, none of this professional medical advice. You're taking these 3 days in a row, okay? And on the 4th day, you're doing my self-flush protocol as I've outlined to flush out all the dead parasites. Okay, so you can watch a lot of my previous videos. I share with you exactly how that is done using these simple ingredients, but you have to mix them in a specific way and also drink it in a specific way. And after you drink it, you're going to do the probiotics, something they are familiar with, and also do the electrolytes to replenish your electrolytes. Because part of the process is that once you have this laxative effect with the self-flush solution, it's going to give you a diarrhea tsunami. I'm going to ask you to drink more of this water to add more water pressure to the digestive tract to really punch out all the waste material from the small and large intestines. Parasite cleanse is not a one-time thing that you do. Okay? Parasites, they know how to just keep on laying eggs, and they know how to just really dig themselves in, kind of like a beachhead, right? But if you leave that beachhead alone, you don't do anything with it before, you're going to have a castle of parasites. It's going to be about 2-3 months, I'm thinking. And I'm only talking about parasites. They are full-blown organisms. Now, if you do some different tests and they tell you that, oh, you have these other type of parasites, you may have to take albendazole or this other product, and these are prescription strength. These prescription strength will be able to eliminate some of those pests, such as the single cell protozoans. A lot of the things for you to learn moving forward to really resolve your chronic diarrhea completely. Okay, so it's about, all right, identifying, I'm looking at this list. All right, today I'm only sharing about parasites, right? But I really believe if you are dealing with parasites, it's going to give you so many other problems, such as the bacterial overgrowth, okay? They may give you hyperthyroidism. Yeah, they might give you all these other, okay, even colon problems, food intolerance, traveler's diarrhea. Like, you keep on going back to the doctor, right? What do? They keep on giving you all these different things and it's not working. Well, I'm just going to tell you, it ain't going to get any better. It's already been all these months and months. Okay, have any of them even talked about doing any type of parasite cleanse? Very unlikely, because they do not want you to venture down this path and start to learn this for yourself. Okay, as your conditions worsen over time, all right, this is what you could be expecting if you don't resolve this chronic diarrhea, because you may have diverticulitis going forward. Okay, and all this stuff, I see it as potential parasite invasion. All right, and what are some of these different symptoms that you may experience? You have pain, tenderness, left lower side of the abdomen, nausea, vomiting, chills and cramps, constipation or diarrhea, rectal bleeding. Same thing, ulcerative colitis. Okay, the same thing with Crohn's disease, small and large intestines, inflammation, and we got very, very similar symptoms: diarrhea, stomach aches or cramps, blood in the stool, tiredness or fatigue, and weight loss. Yeah, you can go watch this lady. Her name is Kelsey Cook. And she had a little routine about IBD, IBS. And it is crazy. It's absolutely. So that's what I have for you regarding chronic diarrhea. You got to fix it. Okay, it's already been how many months now? You've been going to the doctors, and what have they done so far? Have they resolved? Have they fixed the root of the problem? I don't think they have. And it's up to you to really learn for yourself, how does your body actually work? Okay? How do you actually resolve and clean out this pipework comprehensively? There may be so many other things inside this digestive tract right now you need to get rid of. But also taking note of, hey, before you start going on this whole journey, you just got to replenish yourself back up, okay, right now, because your chronic diarrhea, your electrolytes are very, very low. This is like your daily routine. You got to be drinking coconut water, watermelons, eating fruits, okay, to really build that electrolytes back up. And you can use pink salt, Celtic salt. They have trace minerals in them. And the next part, you're going to study this one by one, all right? Different types of single cell protozoan parasites that are out there, and how do they work inside your body, and how do you get rid of them over time, okay? And thank you so much for watching this video, and I just look forward to hearing your progress. Now, if you want to work with me, and that could be very helpful for you down the line, consider getting on a phone call with me. Or if you can just send me a message on Instagram. Okay, my Instagram is the real John Chow. You can just send me a DM. We'll get on a call. I want to learn a little bit more about you and how I may be able to assist you on your journey. So have an amazing rest of your day, and I just truly wish you vibrant health. Okay, I'll talk to you soon.